Ahora sí.
Okay,
Mm.
we're talking about the consequences of having low hormones.
So what happened is that eventually, the social environment start affecting the lack of hormones start affecting their social life because not only the
Right.
problem with their husband or the partner, problem with
At
their
work.
kids, problem at work, they get angry, they get fired. I mean, you name it, the hormones make you be a pleasant person
Right.
and it makes you feel good, you sleep well and all that. So they're necessary. They're not
And
just.
you see it with your
And
patients
this is what
right
I
away.
see with my patients. I have so many patients that said, "Thank you because you saved my relationship.
Right.
Thank you because I feel great now. My husband is very happy. Things are better.
Right.
The hormones are
So,
important."
for how long do you think we need the hormones or a replacement, right?
We do hormone replacement means that we are using the natural hormones and
Hmm.
we are replacing them. People are not making hormones anymore, so what we do is we just giving them, so they giving them to them, so that way they have hormones that are necessary for the function of the body. How long you want to have hormones? As long as you want to. I mean, you can be 70 something, 80, you can still be using hormones because that's going to keep you healthy and actually it's going to slow down the aging process.
Right.
People that are using hormones, they seem to be healthier and age slowly compared
Anti-aging.
to the ones that are not.
Right.
It's very important. So yeah, you can use them as
And what are the benefits using bioidentical instead of synthetic?
So there was at the beginning we were using synthetic hormones. They
Hmm.
were pretty
Years
much
ago.
man-made. They were pretty manipulated in the lab by there certain chemicals. So if you want to understand the difference between bioidentical and synthetic,
Hmm.
it's almost like they're pretty much close to each other, but they're not. They have several variations. Bioidenticals are natural and they extracted from the plants. Then the synthetic are man-made. So when you have a car that needs gasoline and you put diesel, because they're almost the same, but they're not the same,
They're not.
so it's going to cause damage.
Right.
If you plant it dry and it's water, and you put, instead of putting water, you add oil,
Hmm.
you're going to cause damage.
Right.
So you have to replace the hormones with hormones, but you also have to replace the hormones with natural hormones. The bioidentical, they're called bioidentical because they are biologically identical to the human hormone.
Right.
So the structure of the hormone is identical compared to the synthetic hormone, which is not the
It's not.
same. So a small variation in the formula of the
Hmm.
hormone could cause harm instead of benefits. So we
Right.
have seen at the beginning we were using synthetic hormones for many years because that's what we knew. And we start seeing high incidence of heart attack, stroke, cancer, gallstones, blood clots, name it. So then they did studies and say, oh, the hormones are bad for you,
Uh-huh.
stop them.
Yeah.
And everybody stopped the hormones, and then what are we going to do? Oh, you use antidepressants.
Hmm.
Give people antidepressants. Well, that doesn't fix the
To treat the
problem.
symptoms.
Just
Hmm.
control the symptoms, but doesn't fix the problem. But then eventually we found that there are bioidentical hormones that work beautiful and they really help to replace the natural hormone, the human hormone with natural bioidentical hormones. So I never use synthetic because they're toxic.
Hmm.
So that's the difference between one and the other one. The
Okay.
other thing is how you use them. The oral hormones are not good to use because your body changes the structure of the hormone when it goes through the digestive process. So we try to use them similar to how the body wants to have those hormones.
Hmm.
So your ovary produces the hormones, the testicles in men and the ovaries in women produce the hormones and release the hormones directly into the blood. So they skip the liver, skip the intestine. So it
Mm.
circulates to the body and it does its
Goes
function.
directly to the blood.
It goes
No
directly into the blood.
liver. Hmm.
Yeah. So the best way to achieve this is by using the pellets or implants. It's a little tiny tablet compressed. It's a hormone compressed into a little tablet,
Like a
uh,
rice.
like a
Okay.
little rice, yeah. And when we put it underneath the skin through a little tiny incision, put them underneath the skin, uh, it dissolves slowly over a period of 3 months, and so you have a very steady levels of hormones, and it doesn't go through your stomach or through your liver,
Mm-hmm.
so you get the whole thing the right way, right?
Wow.
That's the other thing about hormones is they need to be balanced.
Mm-hmm.
God gave us three hormones. We give you three hormones:
Right.
estrogen, testosterone, and progesterone in women. And in men, we have to use testosterone only.
Testosterone.
But we had to follow the law, the way God created us, so that way we prevent consequences.
Right. That's beautiful. So, okay, those are some benefits we can tell.
Yeah, the benefits is that number one, the symptoms, most of them go away. So the first thing is that the patients, as soon as they get their hormones, they start sleeping because they have a hard time sleeping, and they on a bunch of medication to help them sleep and all that, and all they needed was their hormones. Sex drive improve, energy improve, brain fog goes away because that's awful. A lot of
Mm-hmm.
patients complain of brain fog and problem with concentration and memory. So
Yeah.
the symptoms will go away. Weight gain also gets better because they gain weight. They gain in
It's a
weight
result of
without the
the lack.
hormones. So
Mm-hmm.
once you balance them, the weight start getting stabilized. Also, it protects the bone
Mm-hmm.
from osteoporosis. Instead of taking calcium and all this bunch of stuff,
Right.
you need hormones to fix the bone. You don't need calcium and vitamin D and all these bunch of drugs that will not help.
They're
It's,
not gonna
it does
work
it
the
doesn't
same.
they don't help that much. So they do something, but they stop the progression of osteoporosis, but they don't reverse the osteoporosis. So you need your hormones. And that's important. So the
Mm-hmm.
symptoms improve. They also slow down the aging process, and people actually get healthier and feel better with
So
them.
the hormones you use in the pellets are those three.
Estrogen and testosterone, and we use oral progesterone
Oral
for
progesterone.
oral progesterone, or we can always use a progesterone cream too. But those are the one for women. For men, we use testosterone.
But how do you know how much hormones different patients they
Yeah, so
need?
everybody's different. This is not like a cutting, it's not a, okay,
A
this is the
pill
dosage
or
for everybody.
yeah.
So it has to do with your age because the younger you are, the more hormones you need. The older you are, the metabolism decreases and you need less hormones. So the dosage changes according to
Changes.
your age, according to your activity, and according to your blood test too. So what we do is we know kind of like depending on your weight, your age, your activities, your function, how much you can get, and also how long have you been without hormones too.
Okay.
And then so we target that. We start with some doses, and then we measure always through the blood or even through saliva, but we prefer blood to make sure that they have the right doses, and then we make the adjustment. It takes sometimes 2 or 3 cycles to adjust, but
Okay.
every cycle lasts for about 3 months.
3 months.
About 3 months.
Okay. Um. Okay. Let's talk about just a first consultation with you in general.
Yeah.
Like I
So
don't know what I have, and I need to know what is going on with me.
mhm.
So what? How would be or how to expect in a first consultation
Well, the
with you?
first consultation pretty much is to get an idea what's going on with patients. So if if you come in here and you have to tell me pretty much what is been going on, it takes an hour. I had to find out what your symptoms are,
Not
what's your
15 minutes.
yeah, not 15 minutes. We
Yeah.
spend an hour
Mm,
for the patient because everybody has a long history, especially it's not just hormones, but if you have a chronic condition
mm-hmm,
like an autoimmune disease,
mm-hmm.
or you have a chronic condition like
Diabetes.
anything, like a chronic infection, more other conditions, it's not easy. Most of these
Chronic
patients,
fatigue or
chronic fatigue, most of these patients have gone through many doctors, they have had many tests, they
mm-hmm.
have had many treatments. So we cannot figure out what's going on unless we spend some time getting the whole information, reviewing the results, figuring out what's going on, and then after that, examining the patient. After that, then we can decide, okay, you need this test, you need this test, because unfortunately people think that few tests are going to give you all the information.
Right.
And it doesn't work that way. You have to order tests specifically
Mm-hmm.
for what you're suspecting.
Mm-hmm.
So if I'm suspecting thyroid, if I'm suspecting a chronic infection, and I'm suspecting this or that, I have to order those tests target to that. So if I don't see the patient in a consultation and I don't obtain all the information, I don't know what to order. And the tests are pretty much to confirm or to rule out what we're suspecting. That's why we have to spend an hour with the patient.
If they're lacking some vitamins, minerals, you have
We do
special
some tests.
tests.
We have a special test that we use. The vitamins are there are very few that you can diagnose with blood. So we have other ways of diagnosing. We do some hair tests. We do different analyses to evaluate the deficiencies of nutrients. If you have chronic infections, there are different tests that sometimes we do in the office. Sometimes we send them to another
Another
specialized
laboratory.
lab. Yeah.
Okay. Are these natural treatments covered by insurance?
Unfortunately, no, and because the insurance don't recognize anything that we do, they prefer to give
Conventional.
you conventional medication and pay for chemo and pay for this and pay for that, but they don't accept any of these type of treatments,
Treatments.
and they're not familiar with this.
Right.
So a lot of these conditions, like the hormone treatment that we do, the evaluation for chronic infections, autoimmune diseases, they're not familiar with that, so they don't cover it. So we don't
Okay.
take insurance. We don't take any insurance. We only do fee for service because number one, the insurance is not going to pay for it. Number two, it's too complicated to be billing insurance, and at the end, they don't pay you for that. So
Right.
we don't take insurance or Medicare. We just unfortunately have to do
This is a
fee for
different
service. It's a
medicine,
different type
right?
of medicine, yeah. So they don't understand this,
Mm-hmm.
and they don't cover it.
Right.
Mhm.
Okay. Something else you want to add?
I just want to tell people that they really need to understand that sometimes they don't feel good and they try to take care of themselves,
Mm-hmm.
going the